Now, away from that, the increasing number of active cases compelled President Akufo-Addo to announce additional directives by making it unlawful not to wear face masks. However, a large part of the responsibility of adherence to the measures of COVID-19 prevention comes down to the discipline of the ordinary Ghanaian. Joining us to look at the social implications on not maintaining these protocols by the population is the Executive Director for the National Population Council, Dr. Letitia Adelaide-Appiah, joining us via Zoom. Good afternoon, Doctor. Now, what could account for the flagrant disregard of the protocols?
Well, thank you so much for the opportunity to enjoy this afternoon. Yes, we all know how COVID is transmitted. And so if we do not obey the protocols and we welcome COVID, then we will be crowded and COVID will continue to spread. So breaking the transmission very much relies on our behavior. And we should know that our behavior affects everybody. Look at the demise of one of our colleagues, being trained for 7 years, coming to serve us, and then because we are being a bit irresponsible, he also gets COVID and he dies. So we really have to know why we have to do what we have to do, and also appreciate the consequences of not doing the needful. Would we rather be isolated away from our family, or we go according to the social distancing and survive? So those are the choices we have to make. We have to know that the responsibility is on us. The virus, there's no vaccine, there's no medicine. The medicine is social distancing. Social distancing, it's not making the virus welcome. And if we don't make the virus welcome, then it will die off. And social distancing is the only way to keep the virus away. When we crowd, we tell the virus you are very much welcome, spread amongst us.
Is that why we've been seeing the spread in the communities?
Yes, of course. As we were told by the president, the virus can't walk unless we move. So we carry the virus, and then we transmit to one another. So the only way to break transmission is to stick to the protocols and be disciplined. That is the only way. Either we do that, or if we get the virus, we go into isolation, away from our family. So the choices are really not very interesting. The choices are the social distancing, so we keep ourselves away from the virus, or if we spread it amongst ourselves, then we go into isolation alone and even die alone at times and be buried without your family. We also have to know that if the virus keeps spreading and we overburden our health professionals, they will come to the uncomfortable condition of having to choose who to survive. And that will be needless discrimination. Because if there are so many people in the hospital, they will have to now triage and decide who should survive and who should not survive. I don't think we need that. We need to get to that.
Right.
The other point is, if we spread, we should be mindful that it will also affect our healthcare professionals. So we'll be getting more cases and less healthcare. So then there will be chaos. And chaos will always come after you. The consequences of chaos is bigger chaos. So for us to break the transmission, we really need to take seriously the social distancing protocols.
Now, Doc, you, of course, are the head of the National Population Council, and you do the analysis to see our resources and how well we can support the population. Let me ask, given our current healthcare capacity, how many COVID-19 cases can we take without, causing serious damage in our healthcare infrastructure?
You see, what we have to realize is that one ICU, intensive care unit, takes about 8 nurses, 24 hours to take care of one patient. One ICU bed would take 8 patients. So we have to do the math. How many ICU nurses do we have? How many ICU beds do we have? How many doctors do we have per 1,000 population? And how many can we sacrifice? You see, we're already in a dire condition. And so the worse we create the chaos, the difficulty becomes, and then nobody has a handle on it. We have to have a societal will. Public health is about community. It's about all of us having the will to survive. somebody says that sustainable development is common sense plus national pride. So we should have common sense enough to know that if we have to defeat this virus, then we have to socially distance or physically distance. If we want to help the virus propagate, then we crowd. It's as simple as that. Already, what we are seeing is that because of COVID, because of the fear of COVID, people are not even accessing the healthcare services. We have immunizations going down. We have family planning uptake going down. We have other services going down. And so we are compounding the problems. And then, in addition to that, we have the economic to deal with. So we really need to act and act swiftly with this. We cannot have the laissez-faire attitude towards this pandemic. The government should be there, but then the population will, the societal will is the next leg. And for me, the most important leg, because you can put in the policies. If the society does not implement the policies, it's as good as wasting the paper.
Thank you very much. Thank you very much, Dr. Letitia Adley-Dapia. She's the head of the National Population Council. You're still live on JoyNews today with me, Daniel David. Stay with us. We'll be right back.